Hello and welcome everybody. I wish you all a very happy Doctors' Day from Team Voice of Healthcare and Manipal Hospitals. So, on the occasion of Doctors' Day, Voice of Healthcare has organized a day long event along with Manipal Hospitals on the theme Happy Doctors' Day celebrating the unsung heroes. So, this panel is on the topic general practice and promoting compassionate and culturally responsive healthcare in India. We have some very eminent panelists here with us today from Manipal Hospitals. Let me start by introducing Dr. Arun Karthik, who is the consultant of internal medicine at Manipal Hospital, Salem. Welcome, sir.
Thank you. Thank you.
We have Dr. Dinesh Kamath, who is the senior consultant of internal medicine at Manipal Hospitals, Malleshwaram. Welcome, sir.
Thank you.
We have Dr. Pramod V. Satya, who is the consultant of internal medicine at Manipal Hospital, Millers Road. Welcome, sir.
Thanks.
We also have Dr. Aravind GM, who is the consultant of internal medicine with Manipal Hospital, Jayanagar. He would be joining us very soon. Now let us start with our questions. So all these questions that we have today are focused on public health awareness. On this Doctors' Day, we are inculcating this sense into general public to take charge of their own health as well as be responsible and do initiatives to keep themselves healthy. So let us start with Dr. Arun Karthik. Sir, my question for you would be, for this Doctors' Day panel discussion, please share those three things that you see in your patients that they do in every day-to-day practice that you'd advise your patients to avoid at all costs. Over to you,
Yes.
sir.
Thank you. Yeah. Thank you. Thank you. Yes. Good morning. Good morning to my seniors and all. And first, foremost thing, patient is the most important factor when it comes to a healthcare. So, but they don't know some of the rights and things. Are they still they're not aware of it. The first foremost thing that I want to my patient to avoid is idiot. We call it as idiot. That is internet derived information obstruction treatment. The patients after getting treatment from the doctors going in searching in the Google of the drugs, they thinking about the side effects, rare side effects, and coming and saying, doctor, this if I take this tablet and this will cause this problem, why should I take this tablet? You can prescribe these tablets. Likewise, they're doing. This is the first foremost thing I advise my patient not to search in Google or do these things. Next thing is self-medication. See, see if the patient come for some other problems, we have prescribed some tablets like examples like painkillers or fever tablets. If the patient having the same complaints the next time without consulting a doctor, that patients are taking without saying this is a pain medication, the doctor is already prescribed, we can take like that. They continually taking without the doctor prescription. And like when we come to a diabetic population, see, we usually prescribe a dose and we'll ask the patient to review after a month or 1.5 months. But the patient does keep on taking the same tablets without consulting a doctor. So self-medication that the patient should avoid, and self-dosing. See, the diabetic patients all, if they feel the sugar is high, they will feel sometimes they will think, oh, the sugar is going high because I'm feeling the burning sensation and all. They will take 2 tablets, sometimes 3 tablets. So likewise, self-dosing, that also I mostly avoid, ask my patient to avoid those things. The first three things, first this internet-derived information should be avoided, that self-medication and self-dosing the tablets also should be avoided.
Definitely, sir. Thank you so much. Those were some very valuable things that you pointed out that we see in practice every day to day. And I'm sure other doctors also agree with us on this one. That we also have a name, very common name for such patients, which are called Google patients, that they already have the probable treatment already in their mind. And it is very hard for such patients to motivate them to believe and have trust in your doctor and the medicines and the treatment that your doctors are prescribing. They feel, and I have also felt that such patients are also very fearful in nature. They have already googled the disease on the internet, and they feel that they have all the symptoms for this very rare disease that is out there, and they start fearing unnecessarily as well and in advance. Although being aware of your disease is one thing, but worrying about it, because there is a vast pool of medical information out there with various different sources, which you cannot judge if it is being very authentic source or a non-authentic source of medical information. So that is
Yes,
also
yes.
need to be kept in mind.
Yeah,
Yes,
yeah.
sir.
I want to say one more example also. Recently, I came across a patient who is from states, had acute pharyngitis. We started with azithromycin, the bacterial acute pharyngitis. We started with azithromycin. After Google it, the patient came to me and saying, "Sir, after taking this tablet, it will cause liver problem." The Google it saying it may cause liver diseases. It will increases SGOT, SGPT values. It's so because I am already have little bit higher values. Like why is they asking this whole thing? Mostly it should be avoided. That's what I.
Definitely, sir. Completely agree. So, coming on to next to Dr. Pramod. Sir, what, according to you, would be those three things that you see your patients do in day to day that you would advise your patients to avoid at all costs? Over
Being
to you.
practicing in the central Bangalore, I completely agree with Dr. Arun. I face the same problem because I practice in central Bangalore where it's the techie hub. So now they're all working from home. So from morning to night, they're sitting in front of the system. So even once cough, they take the first opinion from Google, second opinion from Microsoft, and probably the third or fourth opinion is the doctor's opinion. So not only they check the about the diagnosis, about the side effects of drug, they also study everything about the doctor also, his wife's name, his dog's name, everything. So even before the patient comes to the doctor, he's coming with an expectation that the doctor will give the same thing as the Google does. Okay, whenever the doctor contradicts that, he kind of loses trust either in Google or with the doctor. So normally all these websites are very defensive. Even if there is a small chance of 0.1% of accident while crossing Cunningham Road, still it is highlighted like a black box warning, because if he doesn't do that, that website will be sued. So they are very, very defensive. So reading such websites can not only give you a remotest possibility, remotest side effect and create panic, but also the compliance with the treatment goes down, because 2 tablets he takes, oh, I'm not getting better, probably Google was better than the doctor karke, he'll start discontinue the medication. So that's one very bad thing about Googling before seeing a patient. And number two is mixing medicines from different fields of medicine. For example, if somebody is on a diabetic medicine, he would have been taking some other Ayurvedic medicine along with it, some Amrutanoni, some Ramdev sugar medicine, along with this medicine, and he's not going to reveal it to the doctor, thinking the doctor will be angry. Okay, and when we don't know about other medicines, if the sugar is too low or the patient is having any side effects, the doctor cannot figure out whether it is because of his treatment, the disease itself, or another different fields of medicine. So it's very dangerous to take medicines from different fields. The patient is particular, he can take an Ayurvedic medicine only, homeopathic medicine only, but combining medicine from different fields is very dangerous. Remember, whatever medicine you have to take, the liver has to activate it and kidney has to remove it. So multiple medicine is going to tax the liver and the kidney and is going to damage them. So my most important advice is don't take medicines from different fields of medicine. Trust one, take it. Where there is a will, there is a cure. If you are trusting the doctor, that will is going to cure you. Even with the trust, if you take a dip in Ganga also, you may get cured. So first, most important thing is the trust. Until the trust is there, no medicine will actually work. Third important thing is most patients or most people, of course, don't concentrate on the sleep. If you ask me, after food and water, the most important thing is sleep, even more important than exercise. If there is no quality sleep, there is no quality in life. Most of the times, most of the modern studies show that all the diseases are either because of two things, either because of weight gain or because of improper sleep. When you sleep deep, what we call the delta wave sleep or the yoga nidra, your brain produces a variety of chemicals like serotonin, norepinephrine, which kind of have a calming effect. So most of the diseases you see, headache, fluctuating diabetes, blood sugar, body pains, fibromyalgia, are all due to abnormal sleeping patterns. So always remember, sleep is as important as food and water. So have a healthy, disciplined, timely sleep, at least 6 hours of undisturbed sleep is very important for every patient. So Googling, mixing different fields of medicine is not good. Having a good quality sleep is extremely important.
Very well said, sir. Some of the very valuable points that you shared with us, that people generally do not fail to estimate the value of body's innate capability of healing yourself, and which mostly happens when you are in a good deep sleep. So many of the ailments that you shared, such as simple aches and pains, and even viral infections for that matter, to a certain extent, body has innate capability of healing yourself. You have to just trust the process, you have to trust your doctor. And a very valuable point that you shared, I see this so many times, people taking homeopathic treatments, people taking ayurvedic treatments, along with that they are taking allopathic treatments as well, and mixing all different therapies together, and not getting the results that they desire, which is for sure because you are not trusting one doctor enough, or you are not fully into all the different practices that they prescribe. You are just skimping through all the different therapies and trying to control your medication by yourself. So definitely that you said that having faith in doctors' abilities and your treating doctor is also very important. So coming on to Dr. Dinesh, sir, please can you share your views on three things that patients should avoid at all costs? And it could be the practices that they do, as we saw, Googling or something like that, or could also be health related things that they do, such as, for not exercising or something like that. So could be anything. What are your views on three things that they should avoid at all costs? Over to you.
Good afternoon to everybody. So even I agree with the others that the first and foremost what I want my patients to avoid is going for the Google and searching for the details of the disease. I think present day, this was not so much 10 years ago or 15 years ago. From the past 25 years I've been in practice. First, our patients were very good and they were listening to us. Now we are seeing this trend more and more from the last few years, that they see more in the Google, try to find out about the details of the disease, and they try to inculcate that in not only in them and trying to influence us also. So that is my first thing again for the patients not to do that. When they come, they should have a trust with the doctor, listen to them, and then follow. They'll definitely be all right. The second thing is about the self-medication, which has already been told, that, Google gives them the hint about the medicines also. Their friends are there, their relatives are there. So they go on taking self-medication, which is again wrong. And then sometimes they come late to us, which is again causing more problems and more complications to them. In this second thing, I would like to tell that patients, we have different types of patients. Illiterates are also there, more learned are there, or tech savvy patients are also there. So they should not come with a fearful mind. The moment we start writing or prescribing the drugs, always they feel that we are writing more drugs or we are giving more dose. And so they start, halting us, telling us that, sir, don't give heavy dose, don't give too many drugs, all this. So I think that should not come. The medicine should be as per their disease, as per the dose, and as per the duration. They should follow that correctly so that the disease is well controlled, cured, and so that they will not have problems. So this is one important aspect, that our patient should focus on the complete course and the regular dosing. The last third point which I would like to bring is this cross consultation or going for a second opinion. So if there is trust, definitely that will not happen. But nowadays we see a more trend of our patients. Whenever they have a doubt or they feel that, they start going for a second, third opinion, or they come to us from some other doctor telling that I didn't feel comfortable or I was not happy. If they're not happy, not curing, that's understood. But if that forms a habit to them, that to go and again discuss these medicines, that is a wrong tendency for our patients. I think that strictly as a medical fraternity, we should all discourage them and have faith in the doctor, have trust in the doctor, and listen to them. Definitely, diseases will get cured. It will not very dangerous or not very troublesome. So these are my 3 points which my patient should avoid in our day-to-day practice.
Thank you so much, sir. Very greatly pointed out all the three things that you have said. And apart from this, I feel it is apart from just simply treating the patient, it is also our responsibility as the healthcare community to educate them on proper habits and good practices that they should be following. That if we are not laying emphasis on completing the course of the treatment very strictly, they probably won't pay attention to us as much, and probably would be harmful for their own health. So we have Dr. Arvind as well with us now. Sir, can we please have your video, if that is not a problem? And I would like to ask you this question that we were discussing on, so that which is, for this doctor's day, please share those three things that you feel patients do in your day-to-day practice that you would advise patients to avoid at all costs. Can we please have your opinion, sir? Dr. Arvind, are you there with us? I guess there is some network issue with this. We'll just check that in the back end. Let us proceed now to the next question for all the panelists. Let us start with Dr. Arun first. So, sir, the next question is, please share three practices that you have seen, which are the golden remedy that is most beneficial and best for building innate immunity in your patients. Please share.
Yes, yes. Thank you. In Tamil, we call it as unave marundu. It's the food, the good, healthy, balanced diet. That is the first foremost thing to build up the innate immunity. It includes 25% of carbs and 40% of fruits and vegetables, and 25% of the protein and 10% of the fat per day. This is good fat per day, keeps our immunity in a higher state. Like taking vitamin C rich products like citrus fruits, berries, and cauliflower. These things will keep our will boost our antioxidant effect, and it will also improves our immunity level. And next thing is a good water intake, daily adequate water intake. That's foremost thing. See, we are in the very busy world, going here and there, and we are not taking care of the water intake. So that should be the next thing. And the third thing, in Tamil Nadu, in the lunch we used to have, at the end of meal we used to have curd. That is probiotic. It's a good probiotic. So daily probiotic, it's must for the gut also. So that also I would like to advise. And early bed, early to bed and early to rise. That's also a very important cold remedy that I feel.
So, sir, thank you so much. You basically covered all the best things that are there, but I would still like to ask our other panelists as well. We have Dr. Arvind with us finally. So, sir, can we please have you for answering this question as what have you seen as three practices to be the golden remedy that is most beneficial for building innate immunity in your patients, and what would you advise? Over to you, sir. Sir, your mic is on mute. Can you please unmute it? Yes.
Good morning, everybody. I think sorry for delay in joining today's meeting. Thanks for making me one of the panelists. Okay. So I think combining cultural competence with the cultural humility, and so healthcare providers, we strive to develop multicultural orientation, develop cultural sensitivity, care, and improve communication. However, even when healthcare professionals have a meaningful understanding of the culture, they still can't predict the behavior and attitude of their patients simply based upon the cultural backgrounds. That's because people are very unique and their behavior and beliefs may not always reflect those of the cultures. So, given this, the healthcare professionals, we must focus on building cultural competence and cultural humility, recognizing the limits of the people's knowledge of others. It also acknowledges that even people who have cultivated their cultural awareness can still have unintentional, unconscious bias about cultures other than their own. So it also involves ongoing process of self-evaluation through the exploration of reflecting on their own beliefs and behaviors. And we can also improve the awareness of implicit bias and foster an approach of patients characteristic of openness and curiosity about each new patient. So coming to the goals, of course, so the aim should be to break down the barriers in the patient care, to get in the way of the patient perception and the care that we get, and also strives to ensure improved understanding within the patients and their providers. So culturally and linguistically appropriate services are planned to respond to individual preferences and needs of each patient. They also help to improve health outcomes and decrease health chances. So according to the US Department of Health and Human Services Office Minority of Health, the principal science class involves delivering equitable care that is effectiveness, understanding, and respectful, and so, so improve the patient experiences and giving some examples of the healthcare and cultural competencies.
Yes, sir. So some very valuable points that you shared, that patients should be culturally aware and they should follow what they have been, culturally brought up. Because as you shared, every patient is very unique, and so they should basically not forget the roots and the practices and the health remedies that they have been following throughout their culture and their family, and should also inculcate them in their modern life. So moving on to Dr. Pramod, sir, what would be your, three inputs on the golden remedies that are most beneficial for building innate immunity? What would your advice be?
No, there is some terminology error here. Innate immunity is also called as a germline immunity. Innate immunity is what you are born with. Most studies date back to its small organisms in the stage of evolution. You are born with certain innate immunity. You are born with that immunity. For example, if your skin is a physical barrier, is a part of innate immunity. Your lysozymes, interferon, CRPs, they are all innate immunity. So innate immunity is what you are born with. Unless you are born with some immunodeficiency condition, there is nothing that can alter your innate immunity. You are born with that. There is another immunity called as a adaptive immunity. As you grow up and you get exposed to various things in the world, your body adapts. We are surviving among millions of germs around us, but still we are surviving. I'm able to sit and talk to you because in the evolution, the human body has made certain changes, which is called as the adaptive immunity, to fend off all the organisms which keep on growing as you grow up and as you get exposed. For example, if you have a kid that's going to a nursery school, or a year after that, you see the kid getting frequent fever. Fever every 2 weeks. The kid starts the school every 2 weeks, it keeps getting fever. That process continues for 1 or 2 years. After that, the kid will stop getting fever so frequently, because each time the kid is exposed to that organism, he develops some short lasting immunity, which is called as the adaptive immunity. Similarly, vaccination. Vaccination gives you a lifelong immunity against a particular disease. Even that is called an active immunity or an adaptive immunity. So as such, innate immunity, nothing can alter it. But as you grow on, the adaptive immunity that you develop as you come across the various things that can trouble you in this world, you go on increasing your immunity. Now, well, that adaptive immunity can increase with vaccination, with exposure, with food. And as the most important study shows, that your gut microbiome, the bacteria in the gut, are very important. They, in fact, are the first line defensive mechanisms that can take care of your immunity through whether it is through the food or it is through a respiratory tract or any other gut, because they produce various chemicals and which kind of alter the immunity, maintain your body weight, maintain something called as a homeostasis. So as such, immunity is what you are born with. Unless you are deficient when you are born, you don't need anything for it. As you go on, for example, you had COVID for 2 years now. Most children were at home, not going to school. Now you see schools have started, even grown-up children are getting frequent fevers, because 2 years you have kind of fended off from all the germs that can contaminate you. So your immunological memory has gone down. So the most important adaptive immunity is, as you get exposed to various things, your body makes an adjustment. As we all know, survival of the fittest. We are surviving because your immunity makes you fit once it's exposed to the adverse conditions in the environment around us. So adaptive immunity, definitely it improves with exposure, okay, with of course the food, exercise, your body homeostasis, good quality sleep, and gut microbiome. But innate immunity is something you are born with. Very little things change that.
Thank you for pointing out that, sir. And definitely, we cannot change what we are born with, but we can have these healthy practices in our life, as you shared, to improve our, adaptive immunity. As you rightly shared, can we have the views of Dr. Dinesh as well, please? Sir, what three practices that you see are like very good for building immunity, and what would you advise for patients?
According to me, the three practices for the golden remedy of our patients are: first, healthy and nutritious diet, which already Dr. Arun has elaborated and told. Second one is regular exercises. We, in fact, if you know that about 15-20 years back, we need not have to tell our patients what exercise, because it was a part of our life. They used to walk for all small things, get things done. But now, because of more modernization and more lifestyle changes, people use vehicles, and they have almost forgotten what is walking or what is exercises. Every patient, I think, will have to keep telling them that do some regular exercises, do some isometric exercises. So because this has lacked in the present day situation, I think that forms a very important, advice to our patients to do regular physical exercises, which will also help to develop their immunity. And third thing, which is already been told, is an adequate sleep. 6 to 7 hours of good sleep, deep sleep, is very important. Now, because of this modern gadgets, people are more, spending time on their mobiles and laptops and all, and their sleep pattern has definitely changed and reduced considerably. We are seeing diseases which are related to less sleep in our patients. In fact, their common diseases are not getting controlled because of the inadequate sleep. So my third advice for all the patients is they should have adequate sleep of at least 6 to 7 hours, which will help, or it is a what you call golden remedy for their healthy living.
Definitely, sir. Very well expressed. And if I combine all the suggestions that have been shared on this point, it always comes down to basics, which is having adequate sleep, deep sleep, having good food, and taking care of exercise as well as water. And that basically cures everything. There is a great need. People feel that these are very basic things, and these do not sound catchy, these do not sound miraculous in any sense. These are not some pills or potions that you can sell for any desired amount of price. So they feel that this is not important at all. But there is a big need to emphasize the fact that these basic things are what would keep you healthy for long, and these are the basic things that should be fixed at the first and foremost level if you want to stay healthy. Moving on to our next question. The next question to all the panelists is: what two aspects of Indian care ecosystem you feel still needs improvement for building better health of future India? It could be anything that you feel currently that needs more attention or more focus towards. It could be infrastructure, it could be access in the golden hour, it could be anything for that matter, which you feel still needs focus and attention from the government and the health ecosystem side. Starting with Dr. Arvind. Sir, what would be your two aspects that you feel still need improvement?
Okay, thanks, Dr. Asawari. So basically, in India being in 21st century post-COVID, we all have seen what a pandemic can teach us. Okay, so two things I would like to distinguish is our infrastructure should be much more stronger, and we need to increase our paramedical staff and their education, and into the rural areas we need to penetrate more into the rural areas. First thing. Second thing is yes, there's a better way of probably improving our communication between the patient's family members and the medical community to prevent any violence in the hospital premises. These are the two things which definitely we should look forward in the next coming years. Thank you.
Definitely, sir. Very well shared. These are the two things that we have seen also being very big hindrance in the recent years as well. Coming on to Dr. Arvind only, sir, as we were discussing on this another question before you joined, which was please share three things that you see patients
Sorry, there's some
avoid at all costs.
I missed out. Sorry, I missed out the question. Can you just repeat
Yeah,
the question?
I'll just repeat. So, what, according to you, are those three things that you see your patients do in everyday practice that should be avoided at all costs?
Okay, the three things the patient should avoid at all the cost is okay. One is probably I think they need to start doing the exercise or probably at least follow doctor's advice. For example, some of our old diabetic patients, when you tell them to do exercise, I don't know how many of them really do the exercise in the walking. One is second is skipping the medications or stopping the medications or whenever they are advised to come back for follow-up for a biopsy report or so many things they miss out. So probably visiting the doctors on the right follow-up definitely will prevent and definitely to some extent will improve the outcomes. Third thing is of course our food habits. Of course, we all have been following the westernized food habits as my earlier colleague speaker Dr. Arun and Dr. Pramod insisted that our local delicacies are our local food. Our South Indian food is traditionally over a period of few centuries it has been developed so well. It is rich in micronutrients, it is rich in gut flora, it is rich in probiotics like lactobacillus, and it is rich in the fiber diet. So definitely sticking onto our own diet rather than following the Western diet will definitely improve the health of our people.
Definitely, sir. Very very important things that you shared. We also seen this fad of green tea and different sort of teas out there in the market, slimming teas, green teas, slimming juices that have been adopted by many Western, cultures into India. But Indian people also fail to acknowledge the fact that the Indian diets are specially curated for our sort of landscape, for our sort of weather conditions, as well as the Indian body type, to be very specific. And following other cultures' diet would only do so much, whereas following what you or your family has been eating for years would be very beneficial. So moving on to where we left, what two aspects of the Indian care ecosystem that you feel still need improvement or attention for building healthy India's future? On to you, Dr. Arun. Sir, what would be your inputs on this?
Okay.
See, soon following pandemic, the fear of COVID made every people in the remote place come to urban areas. So it's made people in the tertiary care are more loaded with the patients and the stress. So what we have to do, what I feel is we have to improve the facilities in the primary care itself by using the digital India, say digital medias. See, we can make a database. We can make a database where we can connect people from the tertiary care to the primary care. So, like an example, I want to say, see, having or ECG machine, fully computerized ECG machine, where the patient in the village area can be taken ECG. From there, this reports can be interrupted in the doctor who is in the tertiary care, so that the treatment will be correctly given to the patient, as well as the time, as well as the correct care can be given to the patient. The first thing, and the primary in the place where the primary care, the equipments as well as the manpower is very less. So we have to improve the manpower as well as the facility in the primary care itself, so that the care to the rural area will be improved. So what that is what I feel. So this kind of digital thing we have to improve in our future.
Definitely, sir. So, as you shared, instead of laying more and more focus on, the tier 2 and tier 1 cities, which already have good amount of healthcare facilities in there, but building in tier 3 and, the rural parts of India, and prioritizing our attention towards those areas is also the need of the hour. So, Dr. Pramod, what would be your take on this one?
See, the biggest problem with Indian healthcare is there is no consistency and there is no transparency. For example, if a patient comes with the simple pharyngitis, which is a throat infection, 10 different doctors will give 10 different treatments. So that consistency of care is needed. For that, to have a consistency of care across the field, both the training as well as the infrastructure should be consistently available, whether it's a village, town, district, or the city, because your practice depends on the infrastructure and the knowledge you have. So first of all, you have to empower the public health system. So once you empower the public health system, then even a small practitioner, even a general practitioner sitting in a small village can give the best treatment. Because one thing is very true: if you have resources, if you have a big wallet, you can get the best treatment in India, treatment which matches whether it's Harvard or any big hospital in the world. You get the treatment as good as anywhere in the world, only if you can afford it. So if you really dream of giving such world-class care all over the India, there has to be consistency. You will have to empower your public health system, both in infrastructure as well as that. Once you have consistently given adequate knowledge infrastructure, then you should have a national guideline for everything, which every doctor has to follow. For example, if there is a simple case of a pain abdomen, then when to get a CT scan in West, there is a very clear-cut guidelines. If you don't obey that guidelines, the insurance will never pay for you. So you need to have proper knowledge, a guideline-based protocol for each of the disorders, plus adequate infrastructure. Once you have both, you can expect some consistency of care all over. Because once you have, for example, if you are in a West, say, for example, if you move to a small new area, if you find a new house, just like you take a new gas connection, just like you take a new cable connection, you're supposed to go to a GP, general practitioner in your area, and get registered with him. For any problem, you're supposed to go only to that GP. Only if the GP feels that you need specialty care, he'll refer to a specialist. And that specialist also, he has a fixed choice. He cannot refer to whoever he wants. So if that happens, then even the specialist will not be overburdened. Every patient of 2 days headache will not go and sit in a neurology OPD. So you need infrastructure consistency across village, towns, district, countries, as well as a general practitioner, physician specialty. So once there is a consistency, once there is what we had a family doctor concept long back, we had a family doctor concept. You've never seen any patient sue their family doctor. They may sue anybody, but they will not put a case on a family doctor, because he's the whole and soul. Whether it's a small baby, whether it's a pregnant in your family, or it's your old grandfather, he'll go to the same general practitioner. The general practitioner will take a call on who to refer and how to go ahead from there. So that registered general practitioner, if it happens, all the doctors across the country will be equally busy. All will have patients. So it prevents crowding in one area and a vacant OPD in another area. So have a consistent knowledge, infrastructure, and a standard referral facility. If all these things are there, we can hopefully have a clean and consistent and a transparent healthcare in our country.
Definitely, sir. This couldn't be any more precise. So this is precisely what you shared, what we are facing, and what all the clinicians all across India are also facing these days. Consistency across different cities, different areas, different developed regions, as well as consistency throughout government facilities, private facilities, as well as allied health facilities as well is required. So very well shared. Moving on to Dr. Dinesh. Sir, what would be your take on, for two aspects that you feel still need improvement or attention?
Yeah, according to me, my two suggestions for improving the Indian care ecosystem is, one is we have to reduce the doctor-patient ratio. Now we see that either doctors are having more patients, overcrowded, which they cannot give enough, attention to all the patients. Even patients are finding it a problem that their enough time is not spent on them, and adequate or what do you call total treatment is not being adequate. So if we can have a good system in future from our governments, where the doctor patient, that is where the patients are more crowded, you have more doctors, so that will help for giving a good treatment to all the patients, will full-fledged treatment. Second thing is, our government should focus on preventive medicine. See, if we have good amount of health education, you give a good posters in the hospital where what prevention care has to be taken for the patients, how to detect the diseases early, what care has to be taken. So if either through the print or through the media or through the articles, give more and more education to our patients, so that if we could prevent so many diseases, again our health system is definitely going to improve. We will be having more of a healthy people in our country.
So, sir, you just connected this answer with my next question that I was about to ask. That we have seen that people approaching doctors only at the very last stage, when the pain is unbearable, or the disease is very obvious, or or they have tried all the remedies from all different sort of practices, and then when they are not able to cure it themselves, only then they would approach their doctors. Or, as I'm a dentist and a public health specialist, I've seen in my dental practice as well, patients reaching me only when it's time that the tooth cannot be further saved. There no RCT can be done, only extraction is the only possible option that is left. So patients neglecting their health till the very last bit is a very common thing that we've seen in practice in India. So, how can we promote or inculcate this responsiveness, this quality of taking care of their own health? And what do you suggest can be done regarding this? So, over to you, Dr. Dinesh.
Yeah. So I think our patients should, once they are given an advice about preventive medicine, that is to detect diseases at an early stage, we should be able to give a good communication to the patients. What are the warning symptoms? See, it may be a simple fever. Maybe 1 day, 2 days, they can take some paracetamol, dolo, and try to be at home. But if it is giving an odd symptom, extremely tired, or it is being associated with dehydration, it is prudent that they approach the doctors early, so that a necessary investigations and treatment will be given, and they can be, save even their costs also. So first thing is, patients should understand what symptoms are important, approach the doctors early, so that an early diagnosis is done and they can get good treatment without much of complications. So this is one which our patients should understand about this. And second thing is regular health checkups. I think at a particular, see, all Western countries, it's a dictum that whenever they join a job, a regular checkup has to be done once in 2 years, once in 5 years. They have a protocol that it has to be done, whether they have a disease or not. That concept is not well advocated in our country. Only a few companies do that, but not all of them. So my suggestion is, at least after the age of 30, you give a basic health checkup to all our people, and then depending upon the family history or the positive findings, make it once in 2 years or once in 5 years, depending on each patient, and try to do a regular checkup, so that whatever is the problems in the patient can be detected and treated early. So these two aspects, I think, from our patients is most important.
Definitely, sir. Very rightly pointed out. And as you pointed out, this regular health checkup is required. Dr. Pramod also pointed out that consistency in the care delivery is very much required. So we can see from this discussion many things many topics are emerging that still need, government's attention, as well as attention from the health fraternities, as well as pretty much everybody around the country to improve our healthcare system immensely. So, Dr. Pramod, on this, what would be your take on, the things, sorry, if I have already asked you this question for
So
improving and building. Yeah,
for
it was
improving,
on.
I didn't get you. You mean
Yeah.
making people self-responsible about their
Yes,
health?
yes, yes, sir. So
It's a
what
very,
can be done?
it's a very difficult question actually. It's a personality. Some people are overly bothered about their health, and some people don't bother about their health at all. So it's a very difficult problem for people who are never bothered about the health. It's very difficult to convince them that health is as important as your property, as important as your children, as important as your wallet. So it's very difficult for people who are very careless and don't worry much about your health. But it's important. Patient education is very important. Sometimes scaring people actually helps. For example, when there was COVID, you didn't need anybody to tell to wash your hands, to wear a mask, to have a safe distance, without telling school children, old people, young men, all of them were very why? Because the scare. So nothing could educate our people more than that scare of COVID. So sometimes, although we value compassionate healthcare and patient education, sometimes in people who are overtly resistant to all your advices, it's sometimes worth scaring them. Sometimes you see somebody died in my office. He was 24-year-old. I've come for a health checkup. After Puneet died, our film actor Puneet died, there was a rush for all the cardiac tests, treadmill tests. So many times, this stress drives the people more than anything. So sometimes it's good to scare them so that they are more aware of their health. Just like when your kid gets a small cold, you're so worried, you can't sleep in the day, you can't sleep in the night. But at the same time, when you are ill or there is a potential to become ill, you don't worry about it. So it's very important to tell them that your health, without your proper health, you cannot do anything in your life. Body is a machine. Just like we service our car every year, you'll have to make sure that it's kind of looked after, it's kind of regularly checked to make sure that there is no potential for getting burnt out. Just like before going for a long drive, you check your car, like that you have to check your body every year, especially after, as the doctor said, after 20 cholesterol, and after for 30 to 40 years, I recommend regular health checkup every year. It also depends on what family history they have. As per me, only two things matter in your life. Your life expectancy matters on your family history, and the second thing is your lifestyle. Family history more. So your once you have a family history of so many different things, you're extra cautious. And so you have to tell the patient that you have a family history of a premature heart disease, a family history of cancers, family history of 3 diseases. So you will have to be extra careful. Compare your normal friends around you. So these kind of patient education with a bit of scaring really helps them, make them more vigilant, makes them to be careful. So COVID has given us a good idea on how to make people responsible about their health.
Definitely, sir. Very well shared. And in my education of public health, also there was this practice that I was learning about, which is designing interventions looking at the mindset of the target population. Suppose this one intervention of scaring people to make them more aware about some disease or some vaccine is working in India, could not be the case in any other country. Or if some other intervention is working in other country, could not be relatable entirely to India. So analyzing the public's mindsets and then creating public health interventions according to them, and as you shared, scaring worked. So could be the next step which the government should focus on, very individualized and region focused interventions for improving the health of the public. Another thing that I have noticed personally in advertisements and TV is that I have never seen any health facility market themselves much, or any TV commercials or advertisements going on to eat healthy food, drink water enough, sleep well, such of things like that. We have seen few interventions and marketing things going on regarding the use of protection for only having two children in a family, or could be smoking kills, but nothing very aggressive when it comes to health interventions. So attracting government's mindsets and their attention towards having this these healthy practices prescribed and marketed to larger audience and more aggressively is also one thing I feel is missing in India. So moving on to Dr. Arun, sir, what would be your inputs on how can we promote the feeling of taking charge of your own health into your patients? Sir, you are on mute. Could you please
Okay,
unmute?
okay. Yeah. First of all, we should know what is the most important asset for asset in our life is nothing but health. Not going behind the money or buying a car or buying the land or whatever. Nothing is more than health. See, people are realizing after 60, saying, "Sir, I'm having this problem," and in the younger age, running for money, going there and spending time, nothing. So, what we should make them realize the great asset in our life is nothing but a health, a good health. See, every patient, you see, everybody's having car insurance, bike insurance. You take medical insurance, not no one. I feel it's less than 5% I see in the all around the world, all around the India. I can see it's maybe 10 or 5. Only this much only medical insurance there. So thus that much with the reduced awareness to the patient. We should create it. We have to create it. We will create it in the future. And next foremost, then involving the patient in decision making. So I feel the patient after starting insulin, they will feel, "Oh, doctor, I don't want to take this insulin, that insulin." And say we can make it like, sir, we can go for one-time insulin for a shorter duration. It's maybe see the patient again next will tell, "Sir, I'm going for work and doing this and this. I can't take." So you can take it whichever time you want, whichever time you feel good. So involving the patient in decision making, that's also improves their health, their involvement in the healthcare. Next, the monitoring the symptoms. See, like the hypertension patient or sugar patient, once they check the blood sugar or BP, they will feel themselves motivated. They feel they weight also. If they're reducing the weight, they will feel motivated. So it will go. This will make them self care more. The involvement to the self care will be improved. And the impact of, we should also make them to know that the impact of the medication adherence and health. So this how we can improve their self care, not only the patient but also us also.
Definitely, sir. Some very good points that you shared. Moving on to Dr. Arvind, sir, what would be your take on how can we promote this, feeling of taking charge of your own health in our patients?
Yes, nicely quoted by Dr. Arun and Dr. Pramod and Dinesh said. One is, of course, as I said, the awareness of the disease to the patient. We should, as you said, we have both the extremes of the people. For a small insomnia or a sleeplessness, they come and stand the casualty or make the casualty fill up the beds. Some patients who, in spite of a big tumor in the abdomen, they come after 2 or 3 years. We have both extremes of the patient. One is that promotes it. It's also if somebody has a strong family history of heart disease, they is more than 40 years, with a lifestyle, a lot of stressful job. If somebody is a smoker, for them, ideal to do every 6 months annual health checkup and to bring a awareness for cardiac symptoms and to start the antiplatelet or statins depending upon your advice, they need to follow that. And second thing is yoga and exercise. As our Prime Minister Modi recently made a World Yoga Day with a big inauguration in Mysore and a good launch. So I think we have a good public leaders into the PM to make it as a healthy habits to start the day with yoga and exercise. That's a good thing. So finally, to convey the people to bring the improve the health. One is we need to improve our rapport with the patients, between healthcare and the healthcare professionals and the patients and family members. Second is we should have tailored treatment plans because it's definitely going to reduce the cost. Of course, we have that Devi Shetty who made the possible in Karnataka the bypass surgery is doing at 80,000 for the people with the small card holders. Okay, the good government and the private partnership, we made the CABG possible for the poor man. And third is increasing the patient safety. Fourth, reducing the inefficiencies in the health system. And fifth, reducing the care disparities. As my Dr. Pramod said, we have a you go with the same symptom, 10 different doctors will give 10 different treatments for the same fever and a cough and cold. We need to have a protocols and a guidelines, our own local protocols and guidelines, which will be customized to our own population and our own cost, so that the cost can be reduced and thereby we can improve the health. Thank you.
Thank you so much, sir. Some very great ideas and concepts were brought out through this discussion. I'd like to thank all our, participating doctors for taking out time. Ending this session, we have this very last quick question for all of you. As we are celebrating Doctors' Day today, we are celebrating the unsung heroes who work tirelessly day in and day out to keep the nation healthy. So, what would be your 3 things, very quick tips for everybody to cope up in today's culture of stress and pollution and toxicity and staying healthy? What would be those 3 things? Starting with Dr. Arun.
See, I want to say only one thing. I want to add only one thing. Spend quality time with loved ones. That's the foremost thing for everything. All stress, toxin, whatever. So I want to say the only thing: spend time with our loved ones. That's enough for everything.
Thank you, Dr. Arun. To Dr. Pramod next.
Yeah. Now, I always tell my patients, people who don't believe in God cry more for a disease. Because you always need something or someone to either praise or blame everybody. That keeps you peaceful. That won't put your load on. You see, people who are very devoted people, if they get something, they praise the God. If they lose something, they blame it on God. So ultimately, the load is not on you, the load is on the God. So all of us have a specific stress buster. Some people sleep over it. Some people may smoke a cigarette. Some people may believe in God and leave everything to Him. People who don't have any of these are the people who are loaded with stress. Okay, they carry everything. Every failure they carry it on for months. So as you said, yoga is what we say. If you know how to, we are basically a slave of our thoughts. Whatever we keep thinking repeatedly, our mind assumes it to be the truth. If you keep thinking there is some disease in me, there is some disease in me, your mind will assume that you are diseased. And nobody in the world can convince you that you are healthy. So basically, to improve our thinking process, all the yoga makes a huge difference. Because you know how to fend off unwanted thoughts. You can have a control over your thoughts. Once you have a control over your thoughts, believe me, I am a strange believer that you will have a control over the world. This world is basically an habituation of your thoughts. So most important thing is use your stress buster. Don't carry on things, keeping on. Don't think about the same thing again and again. Spend at least half an hour sitting in a quiet room talking to yourself. With that, in those half an hour, you'll know what to filter and what to allow to peek into your mind. So that is the best way of addressing the stress. So each day, once we make it as an habit, you kind of become detached from all the failures and this one. What we call it as a balanced life. Spiritually, we call it as Sthit Prajna. So once you attain that balance, very few things bother you. Of course, I'm not telling you to be a hermit and leave everything, but I'm telling you, once you know how to get detached from all the failures and successes, once you know how to ignore what others are talking about you, once you know how to handle your work pressure as well as the pressure at home, once you'll know only that by regularly thinking, spending time with yourself and habituating your mind to overcome all this. So once you are done, stress and all this stress of present day life or your past life doesn't matter to you at all.
Very greatly shared, sir. And maybe we can have another session with you and other doctors of Manipal hospitals speaking on the correlation between medicine and yoga for World Yoga Day. Why not? So moving on to Dr. Arvind. Sir, your quick tips for the patients watching for coping up in today's world with stress and pollution.
For all my colleagues, medical fraternity, COVID has taught us a good lesson. So to be healthy as a medical professionals, first thing is we should spend some time with exercise, either it's in the morning or in the evening, whether it's a yoga, running, walking, cycling, whatever we like. Second is, as we preach, we should also take a good diet. Time to time, like most of us skip breakfast in the morning because early morning surgeries or the rounds or the other things. So gone are those days. Please have a food so that your immunity will be good. Third thing, we are all human beings. We are not gods as doctors. So please, after 40, do regular health checkups. We have seen the last so many of our colleagues in the hospital, doing working hours, having MI, other things, ignoring their own health. So please, after 40, hospital is definitely, recently Manipal Hospital said, do everybody, all the doctors, please do annual health checkup free of cost. So please subject yourself, spare 1 or 2 hours in a year for yourself for a health checkup. Fourth, if you have any hobby, whether it's reading a book, wildlife photography, or whether watching a movie or anything, please pursue it at least 4 to 5 days a week so that at least your mind is cool and calm. At least stress mind is a part of the stress question. Thank you.
Thank you so much, Dr. Arvind. Dr. Dinesh, your inputs.
My concluding remarks for my patients to stay healthy and to reduce the culture of stress and toxicity. First is healthy diet so that they can reduce their weight and bring it down to near normal for their age. Second thing is to do regular exercises, including yoga and meditation, which all our colleagues also give the importance. Third thing, stop your habits. If you are smoking, please stop smoking. Alcohol, have it in moderation, and have adequate sleep, which is all going to help for a healthy living. These are my advice to all my patients.
Thank you so much, Dr. Dinesh. With that, we wrap up with this very interesting session on World Doctors Day. I thank all our participating panelists. I thank Dr. Arun, Dr. Pramod, Dr. Dinesh, Dr. Arvind for taking out time from their busy schedule and being with us today for imparting public health knowledge and such immense wealth of information to our patients. I would also like to thank the supporting partner, Manipal Hospitals, for organizing the second year of Doctors' Day celebration event with us. I also thank all the viewers for staying with us till the very end. I wish all the doctors in the world a very happy Doctors' Day, and you guys are doing a great job, and we salute you. Thank you so much. With that, we end. Thank you.
Thank you.
Thank you.